Hi guys, I'm 2 weeks post-op from periareolar surgery. Do you know what? I might get there one day. By the time I finish it, like maybe my 1 year update post-op, I might actually pronounce it right. But yeah, so as you can see, things are going pretty well. This one looks nastier than it is. I'll try and lean forward and show you now. Bring the camera forward. Yeah, so it looks pretty nasty. If the lighting was better in here, it would look even nastier in all fairness. But you can see in the middle here where it's all like glowing red. It's scabbed up and come off all in a week. Under here is still black, but the rest of it's gone pink again. So yeah, quite chuffed about that. And this one is just looking really happy in all fairness. But yeah, so put the camera right. Yeah, so all in all, things are actually looking pretty damn good. Swelling a little bit on this side, and you can sort of see a crease there where the swelling sort of bulged out a bit. But that's alright. I mean, they had to operate on that side twice, so things are alright. The scars in my armpits have actually healed up now. The cuts there. Same on the other side. But yeah, it's just waiting for this one to heal up. But I seen the nurse yesterday, and she thinks it looks pretty damn good, so I'm actually pretty impressed. I've got absolutely no swelling at all under here or up top. It's just more on the sides and more on this side. So yeah, that's actually looking pretty damn good. But I've been applying loads of cream. I've been applying this cream directly on my nipples that the hospital gave me last week, called 50/50. I know nothing else other than that. But it's this clear jelly kind of cream. It's actually really good stuff, as you can see. But today I've plastered myself in E45. I probably have more of this on me right now than Boots actually stocks in the UK, in all fairness. I've just absolutely coated myself because I'm not sure if anybody else has come across this problem, but I found that the binder is actually cutting up into my armpits and cutting down here as well, and then the middle bit where you do it up is really rubbing the middle. Even though it's numb, it's still getting quite incredibly sore. And then I noticed yesterday when I went to see the nurse that all the skin in those areas was actually peeling away, almost like it does when you get sunburnt. So I went out and bought this, and I've just plastered myself in it from my face all the way down to my legs. So yeah, just absolutely coated in E45, and I smell like a baby or an old person, whichever takes your fancy really. But yeah, so I covered myself in that. I did speak to the nurse about the fact I think my binder was too small for me again, but she came up with the genius idea that it must be because it's keeping my back in the correct position or something like that. I don't know if she just thinks I've just walked around all my life looking at my knees or something with my back arched. I really don't know, just like me, just like that. I don't. What she thinks I've been doing, I really don't know, but I think it's utter crap that the binder could be keeping my back in any form of position, well, any position that I wouldn't have been doing in the first place, so, I mean, I've been binding for like 6 years, and it just so happens to be this one binder that is hurting, so, yeah, that has baffled me a little bit. The scars on the edges, well, there isn't really a scar yet, but, as you can see on the one side by here, it actually almost looks like there's barely any line at all, so I'm kind of hoping that it's just all going to blend together and everything's going to be dashingly well. I'm still waiting for the nipple to actually reappear on this side. I'm not even sure if it's there, if I'm honest. I don't know. But I think give it a couple more weeks. Healing, it should be okay. But I did notice that the nipple on this side is actually right at the bottom. See it there? Right at the bottom. Right by there. So, I don't know if the nurse was looking through one eye or like a toilet roll tube or something when she was cutting around, because she just hasn't put my nipple in the middle of the areola. But, man-made, what do I expect? But, yeah, that's what I was going to say as well. I noticed that they're not actually even. My nipples aren't even. This one's lower down than this one. So, yeah, that bothered me a bit, I think, for a couple of days. But I think because it was so black, it just stood out like a sore thumb, or sore nipple, as the case may be. But yeah, as it's going more and more pink, I think I'm just noticing less and less. But we'll see what's like when I'm fully recovered. If I'm still not happy, then I have the option to go under the knife again. But we'll have to see. But weirdly enough, since having this surgery, hair has just started forming everywhere. I'm not sure if that's just coincidental or I don't know, but everything seems to be getting really hairy. And I've got hair growing right here on the edge that I can't shave because, knowing my luck, I'll probably take my nipple off with it, with the blade. And same on the other side as well. I'm not sure I want to be a hairy person. I don't know. It might look more manly, but then I can't help but think all fit guys wax their chest. You know, and they have like, they're ripped and they got these wicked pecs and then they wax everything and all these women just like, ugh. You know, so yeah, I can't help but think that. I know like some women fancy men when they're really, really super duper hairy, but I'm not really sure that's my kind of thing, if I'm honest. But we'll see, you know, we'll see. But yeah, so as far as healing goes, I'm actually doing really bloody good considering I'm just 2 weeks post-op. I returned to work last week. I found the Wednesday night quite hard. The Friday night was sort of mediocre, and then the Saturday night felt great. I don't know if I was just sort of running off adrenaline, but I was just absolutely buzzing. But yet again, I still can't jump around anywhere or dance or do anything like that. I've just literally got a DJ and stand there. So it's quite boring, but you know, I feed energy off the crowd, I guess, and they keep me going. So yeah, it's just amazing, and I'm doing a lot better than I expected to do. On the downside of things, as I said in my other videos, there was a lump in my chest before which turned out to be cancerous, which they removed it all, which was good. But then I got notified at the doctors yesterday that they want to take out some further tests because they basically said because they opened up this area and let sort of exposed it, so to speak, it could have caused it to spread, and they wouldn't know straight away if it had. So I got to have some more bloods done on the 31st of January to just double, triple, quadruple check that there's no cancerous cells left in my body, because they can't be too sure, which is good. Looking on the bright side of things. But yeah, so providing all that goes well, they said I've still got to have blood tests right up until July, just to, like I said, confirm every single month that the cancerous like cells and stuff or whatever it is hasn't spread anywhere, but they won't tell me I'm 100% clear until the summer. So that sort of complicates things a little bit. But in the meantime, I've randomly found a really hard lump by here. Not quite sure what it's about, but I've spoken to my girlfriend about it, and she wants me to go to the doctors. It's right. You can even see it. You can see it. Yeah. So yeah, she wants me to go to the doctors and speak to them about it because obviously with what's just happened and everything, it's probably not wise to just ignore it. But it's actually really quite hard. But I wouldn't know. Like, people have asked me if it's sore or not or anything like that, but I actually can't feel anything on my chest, so that's probably even more worrying, if anything. So I'm going to book an appointment and go and get that checked out as well. It's probably best, if anything, to get a biopsy done now while I can't feel anything, because they bloody hurt as well. But yeah, apart from that, anything else I missed? Oh, I'm wearing new dressings now. I'll get them for you now. Yeah, so sorry, I'm in bed. Yeah, so I was wearing these like huge plasters last week, putting this on 50/50. Ointment flammable, goes off in 2016. Yeah, so I was wearing that, and then I was putting that like coating my nipples with it. It's like jelly stuff. It looks like Vicks, really. Doesn't smell like it though. It just smells like like burning rubber almost. But yeah, now I'm wearing these Melin. That's how you pronounce it anyway. I really don't know. With tape. So I'll actually show you now what I do. What time are we on? 10 minutes. Okay. I'll rush this. Don't worry. I won't hold you up much longer. So I wear these, and see one side is shiny, and one side is not. I had to read the instructions on the packet, which I never thought I'd do. But yeah, I've got my scissors. 2 seconds. Water's getting up and getting down. Right. So yeah, that was another thing as well. These lines going around my nipple. You can sort of see when I do that. I'm hoping they're going to iron out soon. Hoping anyway. But yeah, so I got this shiny, and it turns out that you need to put it shiny side down, so the dull side is facing the other way. Does that make sense? Which is really weird, because that's like the texture of a carrier bag. But I decided I wasn't going to put one of these on each nipple, because it is just absolutely gigantic. If anything, I could probably cut that into 4. But as it goes, yesterday I cut it in half. I'll actually see now if I can cut it in half again. My scissors are so blunt. Right, done. So I cut it in half, and then I went like that. Probably get away with cutting it. Yeah, I probably could. Got my concentration face on now. Yeah, because the nurse suggested these dressings and then gave me 7. And I was like, oh, do I have one nipple that needs taking care of more? I'm not quite sure. But I think, to be fair, she just grabbed a handful, didn't even count. And then I'll stick that on there. Yeah, she just grabbed a handful, didn't even count it, so whatever. I'll just go back when I need some more. So, okay, yeah, stick the tape on the dull side, which is the tricky bit. It starts to turn into a Blue Peter bloody thing, isn't it? Right. Shiny side. Shiny side. Can't really see, can you? Yeah, shiny side. Down. I think that's right, yeah. And then tape. Ta-da! So the reason I switched to these ones was because I actually complained about the last ones, saying, you know, it's trying to scab over desperately. And it can't, because it's not being exposed to the air, and I'm being told to wear my binder 24 hours a day. So how is it supposed to heal? And the nurse basically said, take your binder off for an hour a day, which is exactly what I'm doing right now. It's hard to see. Right, let's take that one down. Probably not going to stick now because of how much cream I've got on. There we go. It's not sticking at all. Yeah, so like that. So basically I switched to these, like I said, to allow them to breathe, so there's still air going in the top at the bottom, which is actually really good. So yeah, hopefully by next week we should have some dramatic improvements, and in another 2 weeks I can let you know what the results are as far as my blood tests go, and hopefully they'll still all be clear. But yeah, like I said, well, like I always say, thanks for watching, and thanks for your support, and yeah, you know, if this is the first time you're watching one of my YouTube videos, then be sure to check out the rest. If you need to ask me any questions, then add me on Facebook. That's DJ Billy Joe. I'll put a link down the bottom, or my name or something like that. But yeah, so thanks guys, and I'll catch you next week. Wish me luck.